Welcome to the HR Empowerment Podcast, where we will uncover strategies and new insights from HR professionals who discuss up-to-date regulations, best practices, and the most pressing topics like diversity and equity, leadership, dealing with difficult situations, and much more that affect your bottom line and business. Thanks for joining us.
Hey, everybody. Welcome back. Wendy Sellers here, the HR lady. We are here today talking about tools and resources for caregiver support for your employees who are crunched into the generational sandwich and then some. We have an expert here to talk to us about these tools and resources. Welcome, Christy Yates.
Hi, thanks. Happy to be here.
Hey, Christy, in our break, we were starting to talk a little bit about, government programs or at least government resources. Talk to us about elder affairs and how our listeners who are all over the United States can get the help that they need.
Right. So every state, now I say every state, and I have to say I haven't checked out all 50 plus all the territories, but really every state has a Department of Aging, something like that. It'll be called something aging, Montana State Aging or what have you. And you can go there and that will lead you to find state level resources, but you can generally drill down to, say, the county level and the municipal level. And you can find local resources. You could also just Google your county aging, or those are the terms I would put in there: aging, elder care, that sort of thing, caregiver support, and there will be something somewhere, and that's where you can start. And you can people will help you. You will find your way down. The trick is, and we were talking a little bit about this, is, most major metropolitan areas are going to have some services available. It gets trickier when you get out to more rural areas or smaller cities where, and that's why things right now are getting a little bit easier with some online resources, but the state level might also have many of those available. So I'm in California, and we have a pretty robust sort of regional center kind of approach. And so every region of California has a caregiver resource center. And from there, you can find a whole bunch of resources that might be local to you in your area. So, but most states have that kind of support system, and you can find that. There's funding from that federally, and then states, depending on the state, plugs in some more time and money for that.
The number of caregivers has risen from 43.5 million in 2015 to 53 million in 2020, and it is expected and projected to reach 73 million by 2030. Back to you.
Whoa, that is a lot of people that are either working full time, taking care of kids, taking care of elderly or other people too. It could be people that are on home and back from the military.
Right.
I think in our first session, we were talking about how it's not just about kids and parents.
Right.
Families these days are very blended, and because of the cost of living, many people are living together just with friends, and then they become their caregivers. And then there's a lot of people like myself that don't have children, and then we're taking care of other people, and then we're hoping somebody's going to take care of us. Side note, make sure you get assisted living insurance or something like that. I have that, and I've had it for a very long time because I had that experience in assisted living, and because I had that experience, working in the healthcare environment, that I'm like, I'm not going to wait around and hope the government takes care of us, because while they're resources, doesn't mean that they're paying for it. And so I think it's very, very important to go back to our previous conversation in episode 3 for our listeners today to know that even though there are resources available, like Christy said, in rural areas, these people, your employees, can't get to those resources. So that's where you really need to think about, okay, can I have, half day Fridays or half day Mondays, or can somebody cut out of work early because they got to hop a bus to go to the elder fair, organization in the area, or whatever it might be. It's usually a nonprofit as well. really thinks outside the box. If you can just give somebody a day off, it doesn't necessarily have to be paid, probably needs to be on their end, but give them time, give them resources, give them a lift to the organization, then guess what you're going to do? You're going to get them to be, retained. They're going to stay.
Right.
You're not going to have to replace them. They're going to be engaged. They're going to be productive. They're going to help you meet your goals.
Right. And I spoke in an earlier episode too about how there are people that leave the workforce because of caregiving. And it's not just the cost of onboarding a new person. It's the loss of institutional knowledge that goes away with someone who's been with us for a number of years, right? And you can't put a financial figure on that all the time. It's priceless, really, sometimes. The other thing is that there are growing numbers of virtual resources. Now, a virtual resource can't come into your home and clean up after your loved one, right? They can't come in there and help you with home dialysis, but they might be able to help you with self-care, right? And your mental health needs, because you have to take care of yourself so you can take care of everyone else. And the other thing in that is sometimes your caregiver sandwich is you might have special needs children who require a lot of support. And then you're now talking about parents or others, a spouse, someone. So sandwiches get pretty complicated. And along that line, I think the one thing I would say is, and I love that you said, Wendy, that you already have this insurance for yourself, but one of the things I talk a lot to people about is having these conversations with your people, having conversations with your family about what you need and what they want. If you don't know what your parents want at the end of their life, you're kind of stuck. And then with things like levels of dementia are rising because people are living longer and all kinds of reasons why. And it's not just because everybody that's old gets dementia, but you can't make a lot of end-of-life decisions when you are not able to make end-of-life decisions. So you have those conversations early and often is what I usually say.
Thank you for that. In our next episode, we're going to cover moving forward. We want to kind of create a little bit of a mini action plan here for our listeners and for HR. And I just wanted to also say on a side note, as the HR lady, I'm always looking for feedback on the program. So if you want to be a guest or you have any topics that you want to hear about, just let us know. You can just drop me a line, connect with me on LinkedIn, or visit thehrlady.com to get in touch. Thanks for joining us.
Thank you for joining the HR Empowerment Podcast, brought to you by Aurora Training Advantage. We hope you've gained new insight and strategies to navigate the HR profession. We look forward to you joining us again on the HR Empowerment Podcast.